Here's a reminder of how to correctly perform hand hygiene. Ensure you use enough hand sanitizer to cover all surfaces of your hands and rub for 20 seconds. Throughout this video, this symbol will remind you to perform hand hygiene for at least 20 seconds at key points in the donning and doffing process. Gather the equipment on a clean workspace and check you have the correct size neck support and mask. Inspect the clean space halo components to ensure that all parts are present and not damaged. The clean space halo performance checks should also be undertaken and ensure that the battery is fully charged. Now you must undertake a fit check. Occlude the air entry into the mask by placing thumbs over the air inlets at the ends of the mask arms. Take a breath in and check the mask collapses inwards and there are no obvious large leakage points around the mask. Fit the head harness onto the face mask. Hold the harness, finding the two keyhole clips at the end of each elastic strap and the marker, indicating the front of the harness. Fit the harness clips to the buttons on the inside of each mask clip. Ensure that the harness strap with the front marker is towards the front of the mask and that there are no twists in the straps. Adjust the harness length by moving the cleats up or down. Loosen both bellows to their widest opening by pressing the silver adjust button on the power unit so that they are fully extended and even. Fit the disposable sleeve cover over the power unit and bellows. Fit the mask to the power unit by clipping the left-hand bellow clip into the face mask. Put harness forward of the mask, ensuring it is not tangled in the face mask. Perform hand hygiene. Don your gown, ensuring it is secured at the neck and at the waist. Tie the tie in a bow so that it can be easily untied when you begin the doffing process. Ensure that the gown is not touching the floor and your uniform is covered by the gown. Place the power unit behind the neck with the bellows and mask resting down one side. The harness should be hanging in front of the mask. Fasten the face mask and bellow clips on your right hand side so that both sides of the mask are connected to the power unit. Pull the mask up to sit comfortably on your face. Pull the harness back and onto your head. Adjust the bellows and harness to achieve a comfortable fit and seal on the face, ensuring you do not over-tighten. Start to breathe normally to trigger the system into the on mode for the air to flow. Small leaks are acceptable as the air in the mask is always under positive pressure. If the air is still leaking significantly, try a new mask as the expiratory valve may be damaged. Clean the used mask and alert the appropriate department that it may be damaged. Next, don a full face visor and adjust to fit comfortably. Perform hand hygiene. Don gloves and adjust the gloves so that they cover the cuffs of the gown. Your assistant should check you are comfortable and that all PPE is donned correctly. You can now enter your patient room or zone. Remove your gloves. Pinch the outside of the glove at the wrist end with the other gloved hand. Peel off completely into a ball and hold in the palm of your other gloved hand. Slide a finger under remaining glove at the wrist and peel it off until balled around the already removed glove. Discard into the waste. Perform hand hygiene. Unfasten the ties at the back and the side of the gown. Lean forward and peel gown away from the neck and shoulders by grasping the gown ties or inside of the gown at the back of the shoulders. Using the inside of the gown, pull one arm at a time so that the gown arms are bunched at the wrists and keep arms extended. Then gently roll the contaminated side of the gown inward and away from the body into a small bundle. Discard into the waste. Perform hand hygiene. Remove your face visor by pulling the straps up and over the head while leaning forward slightly. Discard into the waste. Perform hand hygiene. Don a clean pair of gloves. Your assistant should stand behind you in preparation for doffing the clean space halo. Begin removing the clean space halo by slowly moving the harness off your head in a forward motion. The assistant holds the power unit at the back of your neck. Take a deep breath and hold and press the power button once to put the power unit into standby mode. Unclip the face mask on both sides. Lean forward and lift and remove the face mask and head harness, minimizing contact with the mask by leaving hands on the clips during the removal process. Breathe normally once the mask is unclipped from the power unit. Place mask and harness into a designated dirty container for cleaning and disinfection. It is very important to avoid touching your face after the clean space halo has been removed. Remove your gloves and perform hand hygiene. The assistant holds the power unit in their hands, removes and discards the sleeve and places the power unit into a designated dirty container for cleaning and disinfection. Note that in this simulation, the power unit has been placed on a trolley shelf rather than a dirty container. Locate the power button with your right index finger. You will feel an indent with your thumb underneath the unit. The power button is located above this. Remember to take a deep breath and hold and press the power button once to put the power unit into standby. Here is another look at how to find the power button using your thumb and index finger.